So Ashley, while we're getting ready to get started, I'm going to do a plug for tomorrow's lineup. Tomorrow's our last day of the conference, and our focus is on industry initiatives. I encourage you all to join us at 10 a.m. Eastern Time. Our first presentation is about the Marketing Alliance, which just did a new strategic plan. They've got some exciting stuff going on. We have an award ceremony for our 2 award winners. We have a youth engagement task force report, which should be really great. We have a diversity, equality, and inclusion task force report. And then we're going to wrap up with an update on the economic impact study we have planned for 2022. So Ashley, back to you.
Thanks, Julie. Okay, so next I'm going to introduce our next speaker, which we're very excited to have here with us today, Dr. Stacy Boswell. A little bit of background information on Dr. Boswell. She graduated from the Virginia Maryland College of Veterinary Medicine and completed an internship at North Carolina State University. From there, she was a postdoctoral research associate in the Comparative Orthopedic Laboratory at Cornell, and then completed a large animal surgery residency at the University of Tennessee. The intense specialty training in surgery and equine lameness evaluation and treatment culminated in qualifying for and passing a rigorous examination from the American College of Veterinary Surgeons, thus earning a diplomat status as a large animal surgeon. As a horsewoman, Dr. Boswell takes her horses and mules riding and camping in the mountains with her husband, Sid. They also volunteer with the Gallatin County chapter of the Backcountry Horsemen of America to maintain access and use of trails. She is driven to make horses' lives better through both physical and mental well-being, and she has a strong interest in equine behavior. Working with patients in a low-stress way led Dr. Boswell to be a collaborative author for the equine fear-free modules. Dr. Boswell is also the author of the Ultimate Guide for Horses in Need, care, training, and rehabilitation for rescues, purchases, and adoptions. So welcome, Dr. Boswell. I will hand the baton to you.
All right, thank you so much. I'm super happy to be here and talk to everybody about this topic. I'm very passionate. One of the things that happened, as you mentioned, I did my residency at the University of Tennessee, and I was there from 2011 to 2014. And in 2011, we were still in the middle of an economic downturn. And so because of the university's involvement with a rescue group in the area and their coordination with law enforcement, I ended up being involved, not as necessarily as the main clinician, but all of us were involved in some pretty big confiscation cases. And so, you know, I watched these horses come into the hospital and we did every single thing we could for them, but sometimes we could not save them. And so that led me to get really passionate about getting people prepared for acquiring horses that were at risk and what the things were that we saw in at-risk horses commonly. So I'll take us through a few of those things today. Let's see. Great. Ashley, I know you already did these definitions, but I have them here, so I'll just reiterate because they're so important. Horses in transition are those who are moving or changing from one home, vocation, opportunity, or owner to the next. At-risk horses are those who have an increased possibility of experience a situation of neglect, abuse, or general poor welfare. And when we talk about the increased possibility, I really appreciated the statistics that we just looked at with horses, that owner factors are a big reason why horses end up at risk. I've worked in 9 states in the United States, from the East Coast to now I'm in Montana, and I've seen these horses all across the country. I was in Montana for approximately 3 months when a local farm ended up having the man that was the owner had some serious alcohol problems. His wife had cancer and she passed away, and all of a sudden there were 38 horses that were in need. And so are those horses great? Yes, many of them are. I still see several of them as patients, but there are 8 stallions in this group. And some of that is people, when they start to get sick and they start to age, they just cannot take care of themselves, much less the horses in their care. So these at-risk horses, that risk can be subtle but present. So paying attention to the mental health of the people that are our clients is also pretty important. Okay, so all of these experiences led me to do this book, really out of passion, The Ultimate Guide for Horses in Need. I know these horses are termed rescues by their owners a lot of times, but it's hard because there's this big, there's a spectrum of how needy these horses are and where they come from. But we really needed a realistic and comprehensive resource on the shelf for horses in transition so that an owner can pick this book up. Early on, right out of my residency, I saw a horse and it had been wandering around the mountains in my practice area and wandered into these people's yard. They literally had zero horse experience, decided to keep this horse. And I really wish I'd had this book for them then. They actually ended up doing great. They were great horse owners and they really committed. But it's about getting people to use their resources, but also to have resources available. And also you guys do a great job with lots of resources for horse owners. Okay. So preparation before we have a horse, we want to make sure that we have hay and water available for this horse, basic housing or shelter, and at least some storage of hay. So depending on pasture access, where we are in the country, I would say anywhere from 2 to 12 months of hay stored so that we don't get in a situation where we don't have any. Shelter for this horse might be shade if we live in the south, windbreak and a roof to get out of precipitation if we live in the northern part of the country or in Canada. I think it's really important for horse owners to have a relationship with a veterinarian, a farrier, and a trainer, because these professionals will help help horse owners through things that come up. Veterinary expenses, any horse owner should be immediately prepared to spend $1,000 to $3,000 on a problem with a horse. Keep in mind that colic can happen at any time, and certainly colic surgery is more expensive. And I've certainly done colic surgery on horses that have had a new owner for less than 48 hours. But I think it's important to have that amount sort of set aside, because horses that go into a new group, go into a new pasture, or travel, those are risk factors for developing illnesses. And we might purchase a horse and then shortly thereafter discover that it has some problems which need to be addressed and were previously unrecognized. Here is where I'm going to make a small plug for insurance. If we're going to insure our horses, we need to know the types of insurance that are out there. So there's mortality insurance that insures for the value of a horse if that horse becomes deceased or passes away or is euthanized. Major medical insurance, which helps cover major surgeries or medical colics or more expensive medical problems. Some mortality insurance will not pay out if a problem is treatable. So for example, let's say you bring me a horse. I say this horse needs to have colic surgery. That's going to be between $6,000 and $8,000 for this particular problem. The horse is insured for $4,000. You decide not to do colic surgery on the horse. That means the insurance company may not pay out on that mortality. So the insurance company, if I recommend, if an owner wants mortality insurance, that we also do major medical, because otherwise you may end up having to spend money in order to access that insurance. So then the third type of insurance is for loss of use. That mainly is for like high performance horses, race horses, or stallions. So that's not as common for horse owners to have, but I think it's really a good idea for horse owners to know what insurance covers and what insurance is out there. Okay. So let's talk about where we're going to find our horses. So there's lots of places where people acquire horses. I've had, again, I had the owners that a horse wandered into their yard and they kept it. I've had people say, oh, I kept this horse when my neighbors moved. And then of course, certainly there's lots of people that go looking for horses. So expectations, horses through private sales, usually we know more of their history and needs because they've been owned for a longer period of time. Reputable rescues typically assess health and behavioral needs. They may have the horse for a period of time, trying to make sure that we know what we have, and match horses to appropriate and prepared homes. Horses that come through neglect situations or are confiscated, we may know no information about that horse whatsoever. We may not even know its age. And it's possible we might not be able to determine that because we might not be able to touch the horse. So neglected horses, we should be prepared that there's going to be lots of looking for information because nobody can tell us anything about it. And then of course there's a spectrum in all of these things. Depends on the rescue organization, the horse, the seller, lots of things in the background. So when we acquire a horse, we should expect the unexpected. And I don't mean to be a Debbie Downer here. I just want to make sure that we can identify these things because many of them are treatable or manageable. So we might get a horse and it might be halter trained or it might not be. We might be told that it's trained to ride, but then might turn out that he's not trained to ride. These horses, any horse can have a lameness problem. It can be severe, it could be mild, it might be chronic. We don't know for sure if that lameness problem could be a lack of foot care. It could be that a horse has some neurologic or some nervous system deficits. It's very, very common for horses without a known history to be pregnant. Horses may appear thin, and that can be simply from neglect, but it can also be because the horse has an underlying metabolic issue, has tooth problems, has a diarrhea disease, has a metabolic disease. So these things are pretty common. And there's, in general, I think horses that come out of neglect situation, we do not have enough statistics on. The University of Tennessee is working on some of these statistics, but we know, just our feeling, veterinary feeling on the matter is that these horses have higher rates of internal parasitism, external parasites such as lice or mites because their immune system is depressed. They may have secondary wounds or infections, eye problems or injuries. They might not be able to see as well. If they're traveling, moving, or in mixed housing through sales or auctions, we may have shipping fever, strangles, other respiratory diseases such as rhino or influenza. It's pretty common for horses that age to have some skin tumors. I've also seen a couple of horses that have urogenital tumors. So I've seen a couple horses come with owners that they didn't identify that the horse had like a squamous cell carcinoma on the penis. That's pretty common, and because the horse hides that anatomy, that might not be identified easily when people are looking at horses to purchase or adopt. I have also, just this week, I castrated a cryptorchid horse. Neither testicle was visible. This owner got the horse out of an auction in Texas, shipped him up to Montana. He was supposedly a gelding. Then he was not behaving as a gelding. Testosterone testing showed that he was a stallion. Wasn't sure if I was going to have to go look for 2 testicles or 1. I got him on the surgery table. He has a scar, and then I was able to remove a 2nd testicle. So that horse had been improperly castrated. This situation is very, very common in horses that have an unknown history. Paraphimosis is when the horse is not able to retract his penis back up into the normal position in the sheath. And this can happen with horses that are starved or with horses that have neurologic deficits. And so this is a less common problem in general, but more common in neglected horses. So definitely something to be aware of. And these horses, really any horse that has gone through changes or has been rehomed or has been shipped or has had multiple handlers, the mental anxiety that goes along with that can be extreme. And so just be aware that we can find horses that have had either neglect to the point of being fearful where they have not been touched, or they've been abused to the point of being afraid. So these at-risk or neglected horses with common sense and good medicine and some commitment, we can really get the majority of them healthy. It's possible that there are some that we can't get all the way to normalcy, so we should prepare ourselves for that. But I still think that we should try on all of these whenever we can. These horses will cost more than a normal healthy horse, especially in the initial period. So even though we may go look and see that there's a purchase price that's pretty low, we should be prepared that we're probably going to make that up in medical bills pretty quickly. So just helping our veterinary clients and horse owners be prepared for that. If the horse is fearful or wary of humans, it adds to the challenge. If I cannot touch the horse, it's hard to do a physical exam. If these horses, they're not halter trained, it's really hard to medicate them. I know the UHC has a lot of really good resources, but the American Association of Equine Practitioners has also made and then recently updated guidelines for rescue and retirement facilities that goes through a lot of information as well. So just being aware of these resources is helpful. Okay, so the first thing that we're going to do, so we're going to do a few things, but I recommend an examination. And I put it here first because if we can do an examination before purchasing or acquiring a horse, that helps ensure that a horse can meet the owner's expectations before they spend the money. And that helps get the horse to a good home the first time around so it can stay in that home. Even if an owner's already committed to a horse, it's better to be informed. This also establishes a veterinary relationship. So if somebody is a new horse owner, many equine practices do not provide emergency services for non-clients. So what this boils down to is you want to be a client. So even if this just means having the veterinarian come out, establish that you're willing to pay your bills, and the veterinarian knows where you live so they can find you in the midnight when it's dark, when there's an emergency, that's a super helpful thing. And then as rescue groups acquire horses, doing an intake examination, and Bluebonnet Equine Humane Society was nice enough to lend me their equine identification form. It helps if you have a big organization, it helps identify problems, it helps identify the horse so people kind of know. It documents things. So if it's in the medical record, that helps us if we have legal issues and these medical records end up in court. And then discuss costs. So when we're budgeting, what horses can we help? We want to help as many horses as we can, but that doesn't mean necessarily that every horse is going to get every single treatment. So just knowing those costs and being able to make appropriate budgetary considerations is important. We want to be able to prove that we have ownership. So ideally we get a bill of sale, but sometimes we don't. We find the horse on Craigslist, we give the person $300 cash and we go home, and we are so happy to be able to help this horse. In certain states in the West, brand inspections are the legal proof of ownership. So it's important to have that. It's important to have a Coggins test. It's not proof of ownership legally per se, but it does show date of possession. It has owner name and horse name and proof of veterinary care. So it goes a long way with helping to show, hey, this is my horse now, and so we can take care of it. So when we bring this horse home, being in quarantine is important. The main reason that we quarantine horses is to prevent the spread of respiratory disease. Horses that are in transition are highly susceptible because travel is stressful. They may have gone through mixed housing in an auction situation. They may not be vaccinated. If they're thin or weak, their immune system is not going to be adequate. It also has some bonuses. We're going to reduce fecal contamination of pastures and paddocks. So before we move this horse out in the herd or out on our pastures, we're going to make sure that we're not shedding parasite eggs. It also is going to reduce the spread of ectoparasites. So one of the reasons horses that come through these auction situations, they're all commingled. And so lice and mites and ticks can really spread from horse to horse in those situations. And so if we put these horses in quarantine, that helps keep this out of the rest of the herd. It gives our thin horses or our sick horses time to physically recover. And then it also allows our new horse to mentally adjust so they can hear other herd mates. If they need to be halter trained, they can do that. Just adjust to handling a new expectations in a new home. Some horses do great just having that seeing and hearing distance, but some horses need a more close up companion to feel happy. And we want this stressed out horse to feel happy. So it's possible that we can use a goat as a companion. I also have had rescue groups as clients that use a fully vaccinated gelding. So they have a gelding, they know it's not going to impregnate a mare. It is a pretty easygoing horse that can get along with anybody. It's fully vaccinated, and they let this gelding be the companion horse for new horses to help our new horses transition into our herd. So these are all options. So this is the comprehensive plan summary of what I would like to do for every single horse every time it changes homes. And so this sort of outline is really what the book, The Ultimate Guide for Horses in Need, is based off of. So there's a lot of diagnostics that we can do. And then we want to make sure in the book also I talk about some special circumstances that we just don't have time to cover here, but orphan foals, horses that are down and unable to get up, or natural disasters. Those are all places where rescue groups can be really helpful and really called on to help in the community. Okay, just healthcare and feeding. We want to be prepared that we're going to vaccinate this horse or make sure we have vaccine records on a new horse. I do not advocate vaccinating horses if they are a body condition score of 1 or 2. They do not have enough, their body is just not ready to mount an adequate immune response. So the vaccine is unlikely to work, and they're at a high risk situation where they may experience refeeding syndrome, which we'll talk about here in just a minute. I do recommend following the American Association of Equine Practitioner guidelines. So vaccinate for the core vaccines, vaccinate for the respiratory diseases. If it's possible to split vaccines up, sometimes that's nicer for the horse, especially if he's just coming out of recovering. And if there's no known history of vaccines, many of the vaccines recommend boostering in 3 to 4 weeks. So we always want to follow the vaccine manufacturer label guidelines on that. When we acquire a new horse, we're going to do McMaster's based fecal deworming, again, as outlined by AEP and as accepted in practice. So we're going to use the McMaster's fecal to determine parasite load. I think it's also important when we get horses from at-risk situations or those that have been abused or neglected to check for sand. And in this, on the far right, you'll see that this particular fecal sample had quite a bit of sand in it. So we just dissolve the feces and the sand sinks out faster so we can see it. It's my opinion and personal observation that horses that are not able to have adequate access to forage are more likely to ingest their bedding, whether that's sand or small gravel, or they're eating very poor quality roughage, or they've eaten like plastic from the hay nets or things like that. I feel like I've seen that more often in horses that don't have enough, access to forage. Reproductive considerations are pretty important, especially in the early period of ownership. Again, I already talked about my recent Crypt Orchid horse. This is another horse. This one was in New Mexico, and this nice woman bought this horse out of an auction. You can see the sales tag on him, and he only had 1 testicle. She used all of her resources and was able to get funding, to get financial backing from a group in New Mexico, and they paid for this horse's castration, which was significantly more expensive because he was a Crypt Orchid with one of his testicles up in the abdomen. He's a wonderful gelding. She still has him. It's important to, even if we recognize this problem a little bit earlier than that, we want to make sure that this horse is fit enough to recover from equine general anesthesia. That is considered an athletic event, so they need to have enough muscle mass and enough strength to be able to get up before we castrate them. Pregnancy status in mares. This is probably the biggest thing that I see missed. I'm pretty active on Facebook and social media, and I see this all the time, or I hear it from people as clients here. Oh, we got her back in the fall and we did not know she was pregnant. So any horse that we don't know everything about her should be tested for pregnancy. That way we can make sure that we meet her nutritional needs, but we also do the extra vaccine she'll need because she's pregnant. If she's able to withstand ultrasound, rectal ultrasound is reliable after 14 days. So if we do this test early, we may be able to, the advantages of doing it super early is if we identify it early, we may be able to terminate the pregnancy if it's unwanted for some reason. But if we do it early and she doesn't appear pregnant, then we need to make sure we check again 14 days later. I have had a case of a horse that got pregnant at the auction. So that does happen, and we just want to make sure. If we cannot rectally ultrasound a horse, either she can't be tranquilized because she's too thin, or she's a miniature horse and too small, there is a blood test. The Cornell Pasture Pregnancy Panel is super handy. We just send out the blood, and they test several different hormones, but it's important to know the pregnancy status so that we can take care of this horse in the way that she deserves. I'm just going to touch base a few minutes on geriatric horse management. We want to make sure we identify Cushing's or PPID. I recommend testing every horse over the age of 20. So when these horses come into rescue groups, I want to identify this early because I cannot treat their sinus infection or snotty nose if their immune system is not functional. And that's one of the main things with PPID is their immune system is not functional. Be aware that testing is available at a couple of different labs. Michigan State is a little less expensive than Cornell. Boehringer Ingelheim the last 4 or 5 years has had, because they make Presend, the treatment, they have biannual or annual enrollment, and veterinarians can get, depends on the year, 3 to 5 tests for free. So sometimes that's really nice to know about. And if you're a rescue group that has a good established relationship with a veterinarian, you may be able to utilize one of those free tests, and that's a good resource to know about. Geriatric horse management, we want to make sure we're managing arthritis. My main reason for trying to manage this is really, even if we have an entirely retired horse that's a pasture pet, I want to make sure that we don't get in this position with the horse where he's down and unable to get up. I think that this is terrifying for an animal that is a prey animal. I think this is the most terrifying thing we can put a horse through, is to have them be down and unable to rise. The horse's last day doesn't have to be his worst day. So I want to either manage the arthritis where we can stay functional, or consider euthanasia early. So that's all I'll say about arthritis. I'm sorry, I'm going to try not to run over my time here. And then teeth and feeding. I strongly advocate that old age or teeth problems are not a reason for weight loss or low body condition score. So if a horse cannot maintain his body condition score at 4 or more, he should either be euthanized or fed differently. So we should be able to feed a horse adequately with alfalfa-based forage or alfalfa-based pellets that are soaked. And if we cannot get enough food into him, we need to consider alternatives, because if a horse is normal but does not have enough teeth, we either need to feed him well enough, or we need to say, okay, it's time to say goodbye. Here are some really good examples of dental disease. The picture of the grass wad and then the ballpoint pen, those are quids. Horses were ingesting the forage, gumming it around for a while, and then spitting it back out because they weren't able to swallow it. And there's just some pictures here of some pretty significant dental issues. That tooth in the middle that's broken, I was the 4th veterinarian to look at that horse. This horse came out of an auction. It had unilateral nasal discharge, so out of his left nostril only, for 4 years, until I saw it, identified that this tooth was actually the problem, removed the tooth, packed the hole, and this horse it's been 3 years and he's doing great. No more nasal discharge for him. Trouble is, we cannot sedate an emaciated horse with a body condition score of 1 or 2. So what we're going to do is work for weight gain first by meeting his nutritional needs using the soaked pellets. And then once we've had some weight gain, we're going to sedate him and take care of the dental disease. So I know it's a little bit of a chicken or an egg, but we need to make sure that we do our best to feed these horses. And then just bearing in mind, there's lots of underlying reasons. Caloric deficiency is the #1 reason horses lose weight, but there can be underlying issues. And so we either need to identify those and treat them, or be aware that that's why we are trying to pour feed into this horse and he's not able to gain weight. I do want to touch base on refeeding syndrome in horses. This is super, super scary. I have had several patients, some from the University of Tennessee, where we literally have every resource available to them. So thinner horses are at higher risk for refeeding syndrome. Horses with total food deprivation are at risk for refeeding syndrome. Refeeding syndrome usually occurs within 3 to 7 days of feeding, and it can happen in up to 20% of starved horses. And that statistic comes out of some University of Tennessee work. And these horses, what happens is their body that's been starved all of a sudden gets access to high starch feeds, so grass, hay. It's tough because the horse's diet is based on starch, but that causes insulin spikes, and this can cause the horse his metabolism to just go into a very scary downward spiral that can result in death. And so until you've watched a horse die with every single resource available to them, it's really hard to wrap your head around refeeding syndrome, but truly it's tragic. And so just feeding a very thin horse in the early period is challenging, but it's important to follow the science-backed UC Davis feeding plan. So I've outlined that here, and I'm very sorry, I'm now running over. So no grains or concentrates, super important to start with the alfalfa, and then gradually increase the amount of alfalfa fed. The alfalfa may be in the form of alfalfa hay, could be also alfalfa pellets, which you may need to be soaked. So again, this goes back to expense. Horses, a normal horse, if you're buying hay and feeding horse hay, or even if you have access to pasture, you might not need to spend very much feeding a horse, but this is a place where people can get into trouble. So they've budgeted that lower expense. And then a horse with poor dentition, we can feed these horses for sure. But if these horses have to depend on equine senior because they can't adequately chew forage, they can get really, really expensive. And so that's where we can run into trouble, and these horses end up becoming at-risk horses as they age up. So I just want to reiterate again, with these super thin horses, I do not vaccinate them until they have a body condition score of 3 or more. I do not want to sedate them, either for dentistry or for checking for pregnancy, or if we're going to do a standing castration, I don't want to do that until he has a body condition score of 3 or more. And I do not want to anesthetize horses, so those crypt orchids, or if they need surgery for other reasons, they have to have a body condition score of 4 or more. As far as exercise, we really want to make sure that we take things slow, and just keep in mind that it can take 6 months to a year for a horse to recover his body mass or muscle. And that really can be a time period. There's lots of things to do as far as helping this horse mentally and getting him prepared. I don't do any forced exercise such as lunging until he has a body condition score of 4. And I recommend not riding these horses that have been at risk or thin until they have a body condition score at least of 5. So we want to make sure they have enough muscle to do what we're asking them to do. Okay, so I am going to touch base very quickly here on the euthanasia guidelines. The AAP has these outlined on their website. But it's important for horse owners and veterinarians to be familiar with this. We don't want them to stay painful. We don't want them to be trapped in a box stall forever. And we want to make sure that we don't put them through medical or surgical procedures if they have a hopeless chance of survival. So we just want to make sure that we are as fair as possible as we can be to horses. And of course, this is an individual decision, and a lot of times money does play a role. But just know that it is okay to say goodbye, and sometimes that is the kindest thing for a horse that we're trying to help. Euthanasia is definitely justified if a horse is down and unable to get up, if he has incurable chronic pain, if we can't afford to treat his medical needs. So I would rather euthanize a horse that has Cushing's because the owners can't afford to treat that than have those owners lose their home or not be able to feed their children. So, and these are real life decisions that do happen. If the horse cannot maintain a body condition score of 4 or more, I advocate we either change his diet or we say goodbye. I don't think it's fair to have this horse standing in front of forage if he can't consume the forage. So, in planning ahead, we want to make sure that we plan for natural disasters. There's a whole chapter in the book again about that. And then Rebecca Jimenez with the Technical Large Animal Emergency Rescue. She has a lot of things outlined as far as how to prepare for things. So make sure you're prepared for the most common disaster in your area. If you live in the forest, be prepared for fire. If you live in Montana, be prepared for a blizzard. Have an advanced plan for evacuation, or at least have an alternate shelter in place plan so that we can take care of our horses if a disaster does occur. And then planning ahead, and Ashley, I know you touched on this too, but we want to have an estate plan. So we want to include our horses in our wills or our living wills, as well as small animals, dogs, cats, or other pets we have. Leave financial resources for our pets if we can, but also leave very specific information for what we would like to happen to our pets if we're not able to take care of them. Please feel free to reach out to me anytime. That's my email and the book. And then I hope you guys have access to, but if you want to email me, I'm happy to send you the further resources that I have here. There's some specific scientific resources on refeeding syndrome, and then where we can get all that laboratory testing done. Again, just feel free to email me anytime. Thank you guys so much.